The Democratic Republic of Congo has recorded more than 1,000 new Mpox cases in the last week. As the viral disease rages on in the Central African nation, more than 500 people have died and over 16,000 others have contracted the disease since the start of this year. And for more, DD India correspondent Chris Ochamrenga joins us live from Kinshasa. Chris, Congo has witnessed one of the worst outbreaks of Mpox. How prepared are the hospitals to tackle the situation, particularly in terms of vaccines?
Yeah, so the DRC Health Ministry has announced that they have formed a national task force to deal with this Mpox outbreak that is sweeping across the country. And they're saying that these health teams that they have got the experience of dealing with these outbreaks from dealing with different infectious diseases like Ebola and the COVID-19 pandemic. But they are still struggling to deal with this outbreak that is spreading rapidly across the country, and that's because they do not have the resources. The Ministry of Health had announced that they need $49 million to come up with a comprehensive response plan, but the government only released $10 million. And we visited one of the health facilities here in the capital, Kinshasa, where patients of Mpox are being treated, and the health workers there were overwhelmed by the number of patients. There was one patient who came in and there were no beds to accommodate him, so he had to stay on the veranda for hours as the health workers tried to improvise and get a place for him. And so this is the capital of Kinshasa, which has relatively better facilities than many other parts of the DRC. And so the situation in some of the rural areas is really bad. And that is why the DRC government has called on the international community and organizations like the World Health Organization, the UN, to really come in and help them to deal with this outbreak that is spreading very fast across the country.
And Chris, what is the administration doing to prevent the spread of the disease? That's a big challenge at the moment.
So they are urging people to cooperate with health experts, to adhere to the health measures that have been issued by the experts. They're calling on people to wash their hands, to keep a social distance, and notify health authorities about any patient who has suspected cases so that he can be immediately isolated and treated to prevent the disease from spreading further. They've also been telling people to avoid eating sick or dead animals because there are two strains of Mpox that are circulating in the DRC. One of them is known as Clade 1, which is, scientists say, is spread from wild animals to people. And then there's another strain, a new strain known as Clade 1b, which is mainly sexually transmitted, although it can also be transmitted through the traditional ways of coming into contact, close contact with people. And so they have been urging people to change their behavior, to watch what they eat, and also their sexual behavior. And that is something that people are still taking up slowly, because there are parts of the DRC, in the east of the DRC, which is a conflict zone. Many people are cut off from the communication in this part of the DRC. And so it's a huge challenge that the DRC is going to be facing, dealing with this outbreak that is spreading very fast across the country.
Chris, I appreciate you joining us with those updates from Kinshasa. Stay safe.